Michelle, we've already heard from Dr. Secord about how many patients present with what Dr. Secord refers to as these non-specific symptoms, the bloating, often changes that many women associate with going through menopause.
Exactly.
Those symptoms, some of those you experienced yourself, yes?
Yes, I had those symptoms and then some for probably about a year.
And those symptoms you thought initially were all part of going through menopause?
Menopause, IBS, the bloating, the incontinence.
And then later on, when these symptoms persisted, you knew from your own body that something just wasn't quite right. Is that right?
Yeah, it wasn't quite right. I was working and ended up having an injury and had a ventral hernia and went into the emergency room, and they verified during that visit that I definitely had something going on.
So for women who are watching this segment, how important do you think it is for women to listen to their own bodies and go and tell their doctors? Is that something that you think the clues were there?
Yeah, it's very important to go and mention it. I went 3 times in a year to the doctor, and each time it's IBS, you're going through menopause, they gave me a prescription and sent me home.
But you knew in your own mind that it was probably something more?
It was something more, yeah. Yeah, only because of the bloats. Like Dr. Secord was talking about, I assumed 51, 52 years old, I had incontinence, bloating. I did go to my doctor and they did tell me I had IBS.
And how long did you have symptoms before you went to get medical help?
A couple of years.
And did at any point in that time, did you ever think maybe this is something more than just IBS?
I did. My body started telling me there's something else going on here. It just can't be the IBS. But then I was premenopausal. So my periods were changing. 1 month would be heavy, next month would be spotting, then nothing at all. So again, I went back to the doctor. He said, it's IBS, you're going through menopause. And literally, as I'm walking out the door, he said, you know what, let's do one more test. He set up a vaginal...
a sonogram?
Yes. And sure enough, he said there's a mass back behind your uterus. So he told me, you need to contact Duke Cancer Center, or we can get you into a CT scan.
And this doctor that you saw, was this your primary doctor or your gynecologist?
My primary doctor.
And prior to seeing your primary doctor with these symptoms, were you going for regular gynecology checkups?
I was a half a year behind, but yes, I'm usually pretty good about going every year. So I was about a half a year behind.
So you went for the sonogram and this detected the mass?
A mass behind my uterus, and we were in the process of setting up a CT scan, waiting for the insurance company to approve it. And during this 2-week period, my mother was really ill, and I was taking care of her and working and not taking care of myself like I should have been. But to make a long story short, I ended up taking care of her. She passed away, and I had to go to work the next day, and I was a catering manager. I was lifting a huge coughing urn, and I ended up hurting myself, and I had a ventral hernia. So that put me in the emergency room. In the emergency room, the doctor, 10 hours later, we were there all day.
Yeah. 3 in the morning.
And they're doing all these exams, and they found the ovarian mass, and they said, we're pretty sure you have ovarian cancer. Contact Duke immediately. So I did. The next day I called Duke, and this was on a Tuesday. Thursday I was meeting with Dr. Secord, and the following Tuesday I was having surgery.
Mm-hmm. Wow.
And it was stage 4.
Yeah, so this is interesting. We thought it was stage 4 because, so she mentioned she had a ventral hernia. Well, she had a hernia sac, and I think what happened was there was so much pressure in your abdomen. That's one of the, predisposing factors for her to get the hernia. And then in that hernia sac, there was cancer. So clinically, I was saying stage 4. Well, the pathologist said, well, technically, since it's in the hernia sac, that's still the peritoneal cavity, so
So it
the
didn't get
pathology
anywhere.
was stage 3C, but I think it's splitting hairs.
And
Yeah.
But
we've
everyone's being
heard a
talked
lot
about.
already about imaging, sonograms, detecting a mass, and CAT scans. When you see imaging from a patient like Michelle, how confident are you that your diagnosis based on scan appearance is accurate? And do we need to actually biopsy the mass in the ovary to confirm the diagnosis, Dr. Secord?
So your question brings up all these different possible care pathways for ovarian cancer. So kind of putting this in context with Michelle's story is we now have different options in terms of how we go about treating this disease. In the past, it was mostly surgery and then chemotherapy, except for patients who were too ill for surgery. But now there's really two main approaches that we use at Duke. So for instance, somebody who's young and otherwise healthy, we go to the OR, we do a surgical evaluation laparoscopically first to see if we can remove all the tumor. If we can, we do the bigger surgery. If we can't, we stop the procedure. Patients have small incisions. We get a biopsy to prove what the disease is. And then we treat with chemotherapy first. That's called neoadjuvant chemotherapy. And after a few cycles of chemotherapy and the tumor's gotten smaller, then we go back and do the bigger surgery at that point.
Before we bring Greg into the discussion, just hearing the words that you've got cancer must be a huge shock, and I'm sure that one of the first questions that pops into your mind is, well, where else has it gone other than the ovary? What information were you given at the time?
Actually, I didn't really think too much about it's spreading or being anywhere else, just the initial, you have ovarian cancer, and of course I had no idea what that entailed. Then the first thing you do is you go start Googling, which is not the good thing to do because you hear all these statistics that just, are horrible. But, Duke Cancer Centers are very good at explaining everything to you. You have a question, they're bringing you information that you can take home. You can call after hours. So I think the initial diagnosis was a huge shock. It kind of verified what the emergency room had told me. So after the first surgery, when I woke up and my daughter and Greg and my family's around me telling me it was stage 4 and how horrible it was, I was shocked. Because I really did not think I was that sick. I mean, it's a silent killer disease.
Right.
You don't know you have it. I think maybe if I wasn't so busy working 60 hours a week and taking care of my mother, and I was just living a very hectic lifestyle. And, this diagnosis, in a bittersweet kind of way has slowed me down.
Right, and I'm
a
sure
lot.
when you have other things on your plate to deal with your mother being sick and just being a mom in general tends to mean that you're at the bottom of the pile for taking care of your own health after everybody else's.
Exactly, yeah.
Often it's not until you stop that you realize that there are other issues that are going on. You can often have the warning signs but not always heed the warning signs.
Yeah, but see, that's another thing. The warning signs mask menopause, IBS, colon cancer. I mean, so it's really hard to try to figure out what's going on. You need to listen to your body. That's one thing I have learned. You need to really listen. If there's any little thing going on, it's better safe than sorry. Go to your family physician and say, hey, look, I have these, and if you're not happy with what he's telling you, then get another opinion.